There's a lot of people out there receiving a not so nice letter from their Medicare plan that they are officially being canceled. Their particular plan is being canceled in their particular area, and that's happening throughout the country. So let's talk about that today and what you can do. And there's actually some good news in there. My name is Ed Weir. I'm a former manager of the Social Security Administration. I help people throughout the country make sure they're getting everything they're entitled to from Social Security, Medicare, retirement, survivor benefits. This is also a live Q&A as well. Looks like I already got a bunch of questions up there. So I'm going to talk about, so this is how this works. I do a kind of a topic of the day, and the topic of the day is so many people getting canceled. We'll talk about that and your options and your alternatives. And then that should take about probably about 10 or 15 minutes. And then I'll open up the floor for the next 45 minutes and help you get everything you can from Social Security, everything you paid into and are entitled to, Medicare and even Medicaid. Tad bit about veterans benefits, but not too much. But anyway, all right, so let's go ahead and get started here. And if you're watching this on a recording, and you see that this is an hour long, I don't talk about Medicare being canceled for an hour. I talk about it for about 10 or 15 minutes, and then I answer questions for the other close to an hour. All right, so what's being canceled? Medicare Advantage and Part D plans. If you have a Medicare supplement plan, a Plan F or a Plan N or a Plan G, those are good. You're going to stay on that plan pretty much forever. Unless you want to maybe save some money and switch from the current G you have to a cheaper G, or from a G to an N, or from an N to a cheaper N, or whatever the case may be. If you're able to do that because of a move or health underwriting, you think you'll be able to pass the health underwriting. It doesn't hurt to save yourself some money. But Medicare Advantage plans, there's a couple of large companies. I always avoid using company names because I want to stay neutral. I don't want people to say, hey, Ed says this particular company, maybe he supports that company in terms of Medicare insurance. The Medicare plan, I may say, hey, in this part of in this part of the country, this particular company's plan is really, really good, but in the other part of the country, that particular company's plan is terrible. So I never talk about names. I avoid talking about particular company names. So, but there's a couple of super large ones that that have announced. All you have to do is Google, and they said they're going to cut back 10% of their clients. So they've sent 10% of the people throughout the country the letter that said, hey, we're canceling you. And that's what I come into live Q&A every day and say, hey, my plan just got canceled, And then Part D plans, the prescription drug plans, are also being canceled as well. All right, so there's straight out cancellation, and then we'll talk about a different form of cancellation here. So sometimes you receive a letter that says you're completely canceled, done, we're leaving your area, or the company is staying in your area, but that particular plan they are completely getting rid of. And what they do is they kind of walk you over to, not figuratively, but they transfer you over to another plan that they have at their choosing. It's not plan you chose unless you don't do anything. And if you don't do anything, guess what? You've officially chosen it by not doing anything. It's kind of like old Marine Corps here. You were voluntold, volunteer and told, same thing, right? Voluntold. So if you don't do anything, if you get that letter and it says, hey, we're going to go and cancel your plan, but good luck or great news. We're going to go ahead and put you in another plan. And unless you look at the details of the other plan, then guess what? You're just kind of assuming that the company is picking the best plan for you. So I would definitely check out the details of the other plan. All right, so there's also another type of kind of cancellation. So there's the hard cancellation where they send you the letter and your plan, we're leaving your area, that plan is gone, you're done. You need to go find something else. Or there's kind of a soft cancel, because what we have here is like these two big companies, and there's other companies throughout the country that are dropping particular regions, and they're for profit. And so they did the numbers, and the reason they're cutting back 10% is because those plans, those people, if you've been canceled, they did not make enough money from you this year or last year. So we're not making enough money from you. So bye. We're just going to focus on places that we make a whole bunch of money because, the CEO needs a new yacht anyway. So they have, also have kind of gray area cancellations where the actuaries and the accountants and the rest of them sat in a room and said, okay, let's cancel that. We're definitely not making enough money on that one. Let's cancel these guys. We're definitely not making enough money on these guys. Well, there's kind of a gray area there. There's a whole bunch of people in the country that should we cancel them or should we keep them? And those gray areas, what they do is, well, we kind of make a little bit of money, but let's make some more money on those guys by switching their plan because nobody ever checks their plan, right? And they have stats to prove that people don't check the plan every year because it's annoying and they're busy. They're living their lives. So what they do is, because your plan is only good until December 31st. Every Medicare Advantage, every Part D plan in the country is only good until December 31st, midnight. Cinderella, it disappears. January 1st, you get a new plan. You have the same card and maybe the same doctor and the same monthly premium, but all the other stuff under the hood, those nasty small print details, they're not really small, but you can, if you know what you're looking for, you can find them. They switch all those, and they're like, okay, yeah, we should have canceled them, but there's kind of a gray area there. We'll kind of keep it. We should be able to keep, we should be able to make a lot of money on those people next year if they don't check. Sure, we'll have some people that will check, that will contact their insurance agent or broker and go over their plans. Or I have, because of this, I've put together a team. I work with a partner that you can reach out to us and we can help you as well. But if you have your own insurance broker, I prefer a broker rather than agent. The difference is they're kind of used interchangeably, but an agent, particularly a captive agent, it's kind of like the old Henry Ford thing. You can have any color car you want as long as it's black. If you have an agent that basically only works for one company or one or two companies, guess which company they're going to recommend? The companies they work for. But a broker, and particularly a good broker, represents a bunch of companies in your area, and they are able to shop around and look at all different plans and recommend any plan that's the best one for you. So that's kind of how I've looked for my team. My partners do that. They look at every single plan, and if the plan that is the best for you is just happen to be a regional one they're not contracted with, they'll just say, call these people. They'll go ahead and get you enrolled. So yeah, so that's why I work with these guys. So there's the hard cancel and the soft cancel. So a lot of people are not going to check, and they're just going to be rolled over automatically to another plan or a new version of their current plan, and it'll go from a Ferrari to a Ford Pinto. Sorry, Ford Pinto aficionados. All right, but there's also some good news. A lot of people love that they're being canceled, because when a Medicare Advantage plan cancels you, you have a guaranteed issue. So if you look at the letter of cancellation, it'll say on the bottom that you have the rights, you have guaranteed issue rights to get either a G plan or the old F plan, depending on your date of birth. And you don't have to go through health underwriting because you've been canceled. So if you're, 67, 70, 75, 80, whatever the case may be, and said, I should have got a Medicare supplement plan. I don't have to go through the networks. There's no networks. There's no referrals, all this other kind of stuff. No prior authorizations. I can go to any doctor in the country, but I'm stuck in Medicare Advantage. I can't switch to a supplement because I'm not healthy to. Well, you've been canceled. You are now healthy. You can switch to a Medicare supplement plan without any health underwriting because you've been canceled. But make sure you keep that letter. So reach out to the person that signed you up, your insurance agent or broker, and say, hey, I need help. Let's go ahead and switch. Did they soft cancel me? Was I hard canceled? Are they walking me over to a new plan without my choosing? Or did they soft cancel me? Or do I have option to go ahead and do a Medicare supplement? Is a Medicare supplement right for me? It's not right for everybody, because it's usually a budget issue with Medicare supplements. There's a monthly premium on that. But if it's in your budget, and if you get sick, it's usually cheaper than actually a Medicare Advantage plan, quite often, depending on your particular situation. All right, so that is it. I didn't do too bad there, about 10 minutes. let's go ahead and get into your questions. And you can ask me questions on anything Medicare related or Social Security, and all the rest of it. All right, let's see here. I turned 65 in March. I'm on Social Security now with Marketplace Health Insurance. I know it will be dropped for that, but will my husband be able to stay on that, and will they go off his income? Yes. So basically, when you have Marketplace, Affordable Care Act, Obamacare, whatever you want to call it, you can technically keep it, but you lose all the subsidies, the cost sharing and the advanced tax credits. And if you don't sign up for Medicare, then you'll get penalized for Medicare. So that's why everybody that knows what they're doing, when they lose their Marketplace, or when they turn 65, or when they're first eligible for Medicare, then they switch from the Affordable Care Act to Medicare. But yeah, your husband can keep it, and just have to talk with the person that signed you up with the Affordable Care Act, and they will run the numbers again and see what type of cost sharing and advanced tax credits you will be able to get. When will the letters arrive? I have not received mine. Yeah, I noticed there's one company, most people have already received it. It's called the ANOC, the Annual Notice of Change. Um, but there's one company that said that they sent it out on October 1st. So maybe that's you. But, might have got lost in the mail, or if you moved and you didn't update your address with Social Security Administration. That's how you basically update your address with all that. Is when you update your address with Social Security, it goes to Medicare, and then it usually goes to all the other places. But it also doesn't hurt to contact your, Medicare Advantage plan and update your address. But if you don't get your letter, no big deal. Just reach out to, your Medicare insurance broker, and they'll be able to look it up on the system, or call my number there, the 888-817-0446, press 1, and you'll be immediately contacted with my Medicare team. Or you can click on the little QR code there, and you can see one-on-one Medicare help. It'll walk you through there. But the problem this year is that millions of people, this is the most disruptive year I've seen in decades in terms of Medicare plans and everything. So 2025 is going to be horrendous. So you might have to be a tad bit patient, because everybody is trying to switch to different plans and switch to G's and F's and all this kind of stuff. So yeah, it might take a bit of patience, but we'll definitely get to you. Waiting for approval from SSDI. Need to renew my real estate license in the next year. Should I try to complete the courses before getting approved, or wait till after getting approved? Yeah, something like that has no effect on on your Social Security disability. That's fine. I mean, if you start selling and start making money, then obviously SSDI, that's an issue. But in terms of education or licenses and stuff like that, it doesn't really, unless obviously you're arguing that you have some type of mental disability and you can't do things like that, and then you go get your license, then that's a whole different issue. But if it's a physical disability, or mental disability that's not relevant to something like that, then no, it doesn't have any effect. Tracy, my 89-year-old dad switched to an Advantage plan via phone solicitation. He hasn't received a card or book and believes it was effective 10/1. He doesn't have a contact name. Who can he contact and switch back? Yeah, I would definitely do that as soon as possible. You can call that number there, or click on the little QR code, and you can just type in or click the little option that says one-on-one Medicare help, and then send me an email too, because we're getting tons of requests for help. Send me an email too at the mygovexpert.com, and then I'll kind of expedite that. So see if we can switch that. Yeah, this is I'm just like everybody else. I hate government, getting in people's business. But this one is a very good one, in the sense of that phone solicitation. They changed the law, effective October 1st. That's not really law. CMS and FTC and the FCC came out with one-on-one. So basically, before October 1st, and y'all know this happens, if you get on Facebook and you push a button that you're interested in Medicare, a plan or something like that, that person contacts you. You're like, okay, I told that person to contact me. But if for some reason they don't, enroll you in a plan at that little time and make some money, then they sell your name to everybody in the country. A dollar here, a dollar there, and they get their money back for advertising, right? And everybody calls you. So that's probably where your father got that information, got that solicitation. But as of October 1st, they can't do that anymore. If you tell John in Topeka, Kansas to call you, John in Topeka, Kansas can call you. That's it. Done. End of story. So hopefully that's going to really, really cut down on calls and solicitations and stuff like that. That's like for us, for my team. If you don't call us, we ain't calling you. So yeah. So hope, but there's still bad actors out there. So I'm sure everybody's continuing to receive calls, but they shouldn't. The people that are calling you that you didn't specifically tell to call, then I wouldn't trust them because they're not doing that right. And so they're probably not going to do everything else right. So there's that. How long after you're approved for SSDI will you get your back pay? Wow, it really depends. If you're talking about an initial application, it doesn't take that long unless you have, you're already receiving SSI and they have to do the calculation, or you have to have a lawyer, or you had a lawyer and they have to pay the lawyer first. Or if it was an administrative law judge, then they have to write up the underwriter, or the legal writer has to write it up, and they have to return it to the judge. And yeah, so it really depends. For initial, it shouldn't take, I've done hundreds of thousands of those, a week or 2 weeks or something like that. But if you're talking about you did at the ALJ, then it might take a month or two. Let's see. Good afternoon, Dr. Weir. Hey, good afternoon. How are we doing? Everyone will know that you are turning 65. LOL. You will get the letters. Yes. And I love John Oliver. Last week tonight, I actually did he did a one on oh gosh, what was that? I used one of his shows, and I think I used a little bit too much, and I got a kind of a strike there from YouTube. Bad Ed. But yeah, he does some great stuff, and he just did one on disability. I reached out to him to see if I could use his his show a little bit more, get authorization to use it. So John, if you're watching, please let me use some of your things. But he did one on data brokers. And how do they know you're turning 65? And because as soon as you turn 65, every Medicare insurance agent in the country and every health insurance, Medicare insurance company in the country wants to take you to the 65 prom. And how do they know it? Every time you type in Google and you look for something or something like that, there's those few data brokers that amalgamate all that information and then they sell it. So if I'm about to turn 65 or 65th birthday present and stuff like that, then they know it, and then they sell that information to these health insurance companies that harass you to no end. Yes. So John Oliver, let me use your stuff. Yeah, hospice. That's the one I did. Yeah, I did one on hospice, but I used a little bit too much of his show, and they said bad. I ask these questions before I just making sure. Good. I am going to apply for my survivor benefits. Will I get the full amount or keep hearing something about one half? For survivor benefits, you get up to 100%. So if you wait until your full retirement age, and then your deceased spouse was receiving either disability, or they waited till their full retirement age or something like that, then you would get 100% of what their benefit was. If they waited till after their full retirement age and they got delayed retirement credits, then you got those delayed retirement credits. So, but yeah, at your full retirement age, you get 100%. The half is for living spouse benefits. So if your spouse is currently alive and kicking, you get up to half. Let's see. I always am in process of disability. Yeah, the whole thing takes way, 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 way too long. I agree. When I took disability claims at Social Security, and everybody, at that time, 3 to 6 months we used to tell people, but now people are the claim specialists at Social Security are telling people 6 to 9 months. I have an offer from a yada 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 Blue Advantage PPO. Any idea if this is a safe plan? Nobody can tell you that. Is this good? Is this a good plan? Is that a good plan? That plan might be awesome for your neighbor, but it might be terrible for you because it doesn't have your doctors or it doesn't have, good prices on your particular prescriptions, or it doesn't have the dental or the extra vision that you need. So, and it might be great this year for you, but next year is the worst plan in your area for you. So yeah, it's that's why with Medicare Advantage, it's zero premium, but the price for zero premium is the price for freedom is vigilance, right? Is vigilance. You have to keep up on it every year. So unfortunately, between October 15th and December 7th every year, you have to carve an hour out of your life to sit down with a Medicare insurance broker and design your plan for next year. So that's if you get a Medicare supplement, you don't have to do the Medicare supplement. You can change the Medicare supplement any time of the year if health underwriting. Get a different plan from a G to a G, or cheaper G. But the Part D thing, you kind of have to do that every year as well if you're getting new medications or something. Tests. Since my birthday happens to be on the 2nd, does Social Security consider me turning 62 on the 1st of the month? Very good, yes. But it doesn't really affect you. Um, because, yeah, if you were born, well, you have to be 62 the entire month. So, yeah, you should be 62. Okay, yeah, because you're asking about the 62 thing. So you're 62 the entire month. So they should be able to start your benefits at that month, and your first benefit check will come the next month. Yes, you're correct. So Phyllis said she got the letter. Yes. So now you just have to, check and see what's the changes are. And there's a lot of changes. Robin, I'm so glad you're here for us. Ed, you're welcome. I appreciate that. My husband and I are both got the letter. We absolutely need our Part D. I'm watching you now to get some answers, but it'll be spent to schedule a time to talk. Yeah. If you click on the little QR code there, you can see that there's one of the options is kind of a personal call with me, and I do charge for those to pay for the phones and all that other kind of stuff. 99% of my help is free, but that's the one thing I do charge for. But my Medicare team, they don't charge to help you with your Medicare Advantage, your Medicare supplement, your Part D. No, nobody in the country should charge you to help you with your Medicare plan, your Medicare supplement plan, your Part D plan. So, yes, nobody should charge you for that. Hello, my something is no longer available next year and is going to be, is this cancellation? Oh, okay, so they walked you, that company walked you from the plan that they decided to cancel and put you in another plan, and it may be the best plan, or it may be not. So it really depends. Again, it might be the best plan for your next door neighbor, maybe not best for you. So I would definitely check it. Get with somebody. Again, the Medicare insurance brokers, their help is free. If you decide to enroll, then they get paid directly from the Medicare company. And my partners, the organization I work with, they look at every plan in your area, and the person you talk to does not get compensated based on what plan you choose. So if you happen to choose a plan that company, which is rare, that company is not licensed and contracted, not contracted with, they'll go ahead and sign you up, or tell you how to enroll in that company. And so the broker has no skin in the game at all. So that's a beautiful thing. I finally got signed up for my Part D to get through the end of this year, but we'll be calling your team to look at the next year for it. Perfect. Perfect. Yep. Yeah, that's unfortunately you got to keep up on it. I wish there was a different system. I wish you could just sign up once but anyway. If I use a broker to help me get enrolled during SEP period, but was not happy with them, non-communication, can I get a different broker? Absolutely. Or do I have to stay with the first one? Absolutely not. You can pick anybody you want. And that's a big thing with kind of individual brokers, that kind of out there doing it kind of themselves, is, they spend all their time trying to get more people to enroll. And they don't have that customer care after service. They're not available 365 days of the year. So that's why Again, that's why I chose the partner I chose, is because 3 months from now, if you're having an issue, you call them up and they've got a team, a specific team that helps you out with after service. Let's see here. My first brand new car, 78 Ford Pinto. I know somebody's going to call me out on that one. Mine was a 72 Chevelle. What is full retirement age? Yeah, it really depends. If you're born in 1960 and after, then it's 67 years old. When will your experts be reaching out about changing our advantage plans? Yeah, if you've already clicked on the little QR or left a message or whatever the case may be, or schedule an appointment, then they should be reaching out. But you can't. There are exceptions, as people that watch my channel know. There's exceptions, exceptions, exceptions with everything, Social Security and Medicare. But most people can't actually enroll in a new plan until October 15th. So the next few days here. So you have between October 15th and then December 7th. But you can check out your plans now. The new plans came out effective October 1st. So people are calling to see if they should do anything. So yeah, they should reach out to you. And if they don't, email me and I will light a fire under them. But like I said, there's millions of people wanting to switch plans, so it's going to be difficult for people to keep up. But my partner has hundreds of agents, so we should be able to get back to you. You even need to ask your local broker how many companies they represent. I used a local broker to help me with ACA and was happy with her, but she only represented 2 or 3 Medicare supplements. Exactly. So my guys review all of them, and they're contracted with most of them. So that is a very, very important question. I'm going to be doing a video in the next few days about the questions that you should ask your Medicare insurance agent or broker. So I'll do that probably in about 3 or 4 days. I've been warning all retirees and Medicare patients to watch for the ANOC letters and ask their drug plans about smoothing RX max costs. Would not have known about those things without this channel. Yes, take and took. Yes, thanks for reminding me. This is an important thing that, yeah, we should kind of mention every time, huh? So with the Inflation Reduction Act, love it or hate it, whatever the case may be, next year, the max you can pay out of pocket is $2,000. This year it's like $8,000. So a lot of people are, very happy with that. But even at $2,000, with the price of medication, sometimes, they have to pay $2,000 in the first 2 months. So like January, they have to pay $1,000. In February, they have to pay $1,000. And then they're good for the rest of the year. But having to pay $2,000 in 1 month or 2 months, that's tough. So part of the Inflation Reduction Act, they did a great thing. It was an awesome thing, I think. They call it smoothing, where you reach out to your Part D or your Medicare Advantage plan, wherever you get your Part D, and you tell, smooth me. And what they'll do is they'll take that $2,000 and they'll kind of break it up over 12 months. So you pay a little bit every month instead of in 1 month or 2 months. So I think that's a great, great, great thing. That came out of nowhere. So that was a great policy. And government can do things correctly sometimes. Go figure. Thank you. I'm smart because I watch you. Oh, I appreciate it. I got a CDR today. I guess they restarted them. Yeah. So they put them on kind of a pause until the new fiscal year, which started October 1st. So as I always say, on that, don't sweat it. Fill it out to the best of your knowledge. If you don't know particular sections, NA not applicable. So for everybody, this is a continuing disability review. So this when you're on disability, every year, 3 years, 5 years, 7 years, whatever the cycle is for you, they send you this continuing disability review to see if you're still disabled. So fill it out, best of your knowledge, and then send it in. Make sure you make copies before you send it in. And that way, if it gets lost along the way, you'll have a copy, and then forget about it, because it's a budget-driven issue and they might not even have money to continue on with your CDR. So it might sit on somebody's desk for a month or two and then they just shred it. And then you wait till next year or 3 years from now or 5 years from now. So please don't sweat it. This is Robin again. What if the letter said you no longer qualify? My husband and I make less than last year. Um, Oh, is it? Oh, this is about the ACA thing. Yeah. So you no longer qualify for the advanced premium tax credits. Yeah, I would reach out to your ACA person. I've got someone that kind of that is. I think the team is in 17 different states. So if you click on the little QR code there, and it will say under 65 insurance, click on that, and it has a list of the states that my uh, other team, my Affordable Care Act team, can help out with. So let me know. I got a letter of cancellation. Is it better to get supplement plan or the medical plan N? Um, Usually with the cancellations, unless you're healthy, it's either G or the F. It's probably going to be G for you. I personally like N, but because I'm cheap, but G is awesome. So, choice number one, G. Choice number 1.1 N. So either one of those is perfect if it's in your budget. If it's not in your budget, then as a lot of people, then you'll have to find the best Medicare Advantage plan for you. So I have Medicare because I get SSDI. When can I sign up for Plan D or Supplement G or N? I am 61 right now and will be full Social Security at 60. Okay, so you have Medicare. So probably because you're under 65, it depends on what state you're in, but most states, they don't make Medicare supplement plans, offer plans to people under 65 because people under 65 have Medicare because of disability, and that's going to cost the company a lot of money. So they convinced your state politicians not to force them to give plans to you. So that's a state issue. So when you turn 65, you're no longer in that issue anymore. You no longer have that problem. When you turn 65, you can sign up for N or G and you're not, no health questions, you're not charged extra or anything like that. So a lot of people that receive, Medicare from based on disability, have to go ahead and get a Medicare Advantage plan. And then when they turn 65, check out the options of a Medicare supplement plan. And it depends on your state. Some states, like New York and different states, Connecticut, I think, yeah, they make the supplement companies do the right thing. So, what plan will be available in place of Medicare Advantage plans that are canceled? Will it be affordable to low income households? Yeah, that's the question. It depends on what's available in your particular area. There's thousands of different plans throughout the country, and so the best thing to do is um, is to check out all the plans in your area. So for Medicare Advantage, when you talk to a Medicare insurance broker, the first thing they do is what's your zip code, and then they find the plans that is in your zip code. And I've had situations where it's like, but my neighbor, my buddy across the street has got this really good plan. I really like that one. Type in your zip code. Well, that's a different zip code, and that plan is not available to you. So, all right. Only 49 of 198 watching. Oh, take it. Yes, please. Thumbs up so this gets more out there to more people. It definitely helps. What is the congressional bill number that is being considered to eliminate the WEP? Do you have any inside info on what the white vote might be? Yeah, that's been yeah, the windfall elimination provision. There's been a proposal like that ever since WEP came into existence. A windfall elimination provision, the government pension offset. But yeah, I think it's 99% of the time up until now, it's just been politicians trying to get votes. So they tell you, "Oh, I'm going to get rid of it." You vote for them, and then just forget about it. So because it's going to add 183 billion dollars to the Social Security deficit. I did a video on that about a month ago. What is my full retirement age if I'm 15? Oh yeah, I don't have the chart right now. Oh, I do have the chart right. Yeah, you just well, I'll throw up the chart. Let's see here. Da, da, da. So, since there was a couple of people asking about full retirement age, da, da. So what? Just look at what year we were born. So 55, you're born in 55, 66 in 2 months, or you're 55 now. So yep, there it is. Um, all right, let me remove that. All right, I noticed a company is offering two different levels of Advantage plan. No, they're probably offering that particular most plan. Yeah, a lot of people don't realize this. They say they think, oh, I signed up for this company, and they're like, okay, well, that doesn't help you because that company has four, five, six, seven different plans in your area. So the company you were mentioning, I'm not going to mention that company. Um, if you're in a big city, they probably have 10 different plans and probably like 20 different plans, but 10 they don't sell anymore. That there's people still eh, there. I've talked to some of these representatives sometime from these companies, and they have, asking how many plans you got in this area. Oh, we got 18 plans on the books. Um, but we're only selling, eight of those, and the other 10 of those are people, that it's just like we got one plan. There's only five people on it, but they refuse to switch, and that plan just gets worse and worse every year. But these people are so stubborn. They're like, "Oh, I like my plan," because they never had to, they've never compared it, and they've never gone to that never had a terrible accident or something like that, or gotten sick. So they don't know how terrible it is, unfortunately, until they get sick or fall or get injured or something like that. So yeah, there's a lot of companies out there that have plans that there's only maybe a dozen or 100 people on or something, that people are just so stubborn. Nobody's going to switch me. So, but they're going to regret it. I pretty much guarantee it. So yeah, that particular company has several different plans. So you just look, you compare everything across it. And I know it's a terrible system, but you got to spend an hour every year checking it out, because your situation changes every year. So here's what I always recommend. If next year you need a bunch of dental work, you get a plan that has the most dental work. And it's like, well, but it really does have my doctor or this other doctor I like, but I'm not really going to go to that doctor next year. So I'm looking for more dental. So you get the plan with the most dental, and you go ahead and go get all your dental work done next year, and then you switch back to the plan that has, that other doctor or that other thing. So if you're going to, have a surgery next year, you find a plan that is the cheapest for overnight stays in a hospital, right? So that's this is your money. All this money that the Medicare Advantage plans are using to take care of you, and provide your drugs, and grocery cards or dental or vision, all that kind of stuff. You're like, wow, this company's really nice. No, that's your money. They're just giving you back your money. They're keeping quite a bit of it, but that's your money. All those decades you paid into FICA, includes Social Security tax and Medicare tax. That's your money. They got your money. Get it back. So that's my job in my semi-retirement. My mission is to help you get all your money back from Social Security, survivor benefits, retirement benefits, but Medicare as well. Let's see. Ed, can you explain what the new SSI household change means? Yeah, so they passed. One of was effective September 30th. The other one, so these are called ISMs, in-kind support and maintenance. So it's basically, which is a welfare-based program, supplemental security income. If you're getting any type of assistance, food assistance or rent assistance or something like that, then they kind of count that against you. And they changed those rules this year to make it a lot easier. So yeah, if you are receiving SSI and you are getting, these kind of what subsidies, food subsidies or food help or something like that, or you're getting rental assistance, or if you're staying in your parents' house or your brother's house or something like that, and that is being counted against you, then it's important to call up Social Security. If you're not receiving the $943, if you're already receiving the $943, the max, then you're good. But if you're receiving less, because the Social Security up until now has been considering you receiving some type of food or rental assistance, then I would contact Social Security and say, hey, does that new law affect me? Can you redo my calculations to bring me up to the $943? So Let's see. I'm having trouble understanding when SSDI when it converts to Social Security. Can I get 50% ex spouse benefit at that time of the conversion? You can get that right now. So basically, the question is when you're on SSDI, supplemental security, excuse me, Social Security disability insurance. When you turn your full retirement age, disability stops. It's just a bureaucratic thing. They stop taking your money out of the disability trust fund and they start taking out of the retirement trust fund. It's still the same amount of checks, still same pay date, but you no longer have CDRs, continuing disability reviews. You no longer have work limitations. But your question is, when can you get divorce spouse benefits? If you're 62, you can get them now. If your divorced spouse has passed away, you can get them at 60, and they just add it on top of your current benefit, minus your own. So there's kind of an offset for your own. But a lot of people, so this is why, come on, press the like button, press the share button, press the subscribe button, because more people are suffering out there and they need to get this information. Social Security is doing a terrible job providing it. If you're receiving Social Security disability insurance and you have, for instance, you have Medicare because of that, a lot of people are paranoid. They don't want to get survivor benefits or spouse benefits or divorce spouse benefits because they think their disability will stop. And if and they're like, well, that's fine. I'll just get more money as surviving spouse. But then they think their Medicare will stop as well. But that's not correct. Their disability will continue. Their Medicare will continue. They'll just get more money on top of that. So if you're 62, you can get that now. All right, let's see. I'm hoping to be able for you to glance at my Social Security case and see what I think is obviously not correct. Yeah, if you set up an appointment, I can do kind of a one-on-one like that. Absolutely. Can I pick up a part-time job while applying for SSI? Um, if you are talking about SSI supplemental security income, yeah, yeah, there are limitations because SSI is a welfare-based program, but you can work and receive SSI. So I've done a couple of videos on that. So check out my YouTube channel. And the one on top is disability, SSDI and working. And the one on the bottom is SSI and working. So check out those and it gets into all of the gory details. Can I get disability along with Social Security? You can't get disability and retirement at the same time, but you can get disability and survivor benefits at the same time, disability and spouse benefits at the same time, disability and Medicare at the same time, obviously, disability and divorce spouse benefits at the same time. Am I missing anything? No, I think I got them all. They can change Part D if not from Advantage program. In open enrollment, can you find a cheaper G without underwriting? Only been enrolled for 2 weeks. Had to enroll due to SEP and they made me. Yeah, SEP. Yeah, if you just enrolled in a yeah, you might still be in that special enrollment period, so you might be able to get a kind of a mulligan type thing, or even if you signed up for a Medicare Advantage, um, you have 12 months. So yes, I would reach out to someone. Again, you can reach out to us if you want. Um, and yes, if you want to switch, you should be able to switch. You're close enough to be able to switch. And if you reach out to us, because this is kind of yours needs to be done, sounds like immediately, if not sooner. Um, let's see here. Probably email me, um, or let's see, best way to do it is call the 888 number. And then if they don't pick up immediately, then email me. And then because the whole thing with, I can't tell them to call you. You have to call. So this is what a lot of people are doing wrong out there. These Medicare agents that are doing the wrong thing. They're saying, "Oh, I'll call you." No, 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 no. You, you have to give me specific permission to call you. And in this format, you telling me to call you doesn't work. That's not compliant. So you actually have to call the number, and then it'll be recorded in the company's system that you called, and then you email me if you don't get in there immediately, and then you email me, and I will call and include your phone number, and I will send that to them, and then they'll be able to call you because you have already they have a record that you called them. The whole thing is complicated. Medicare, which is good. I love these new regulations. They're annoying as heck, but I love them. For the same reason, if you ever go to like into a, let's say, a big mart, and you see like a Medicare table there, and the person is just sit there looking off into the, the void, and you're like, wow, that person's a terrible salesperson. They should be out there, shaking hands and, hey, let's talk about Medicare and stuff like that. Nope, that's illegal. They would get fired. They would lose their license. Y- they can't talk about Medicare until you walk up to them. That's why they got the little sign, ask me about Medicare. As soon as you say, what about Medicare, tell me about Medicare, then they can open their mouths and start talking about Medicare. So until then, they can't. So it's strange, but yeah, it's great. It's great. Too many people are, being taken advantage of with the old system. So this is a great system. Annoying for us people trying to do it right, but you know, what are you going to do? The message cut off. Can I file at 67 after SSDI converts and still get the whole 50% like I filed at age 67 for ex-spouse? Yeah, so yes, so you definitely can. But the whole 50%, you are correct. If you're, let's say, 62 right now and you want to go ahead and get those survivor benefits, it'll be reduced because you're filing early. But if you want to get the whole benefit amount, yes, then you wait till your full retirement age. Yep. Yep. I started on SSI in 2010, was told that I gave up my SSDI benefits knowing what the consequences would be. This is totally not correct. Is there anything to do to revisit this injustice? Um, I gave up my SSDI benefits. Um, you can receive SSDI and SSI at Social Security at the same time. Maybe that's possibly what you're receiving is because if your SSDI, Social Security Disability Insurance, is under $943, so if your SSDI is $900, um, there's another $43 out there. To qualify for the other $43, you have to have, low income, low resources, and then they sign you up for SSI, and you get the other $43. You're already getting SSDI 900 plus another 43. So that might be the case. So yeah, you don't give up your SSDI to go on SSI. Yeah, they would never do that because that is a Social Security, that's money coming out of the Social Security Trust Fund, and SSI comes out of general taxation. So they make you sign up for regular benefits. So you're probably receiving both. What qualifies you for disability? Basically, your disability has to prevent you from working. Substantial. Um, Substantial this year's substantial gainful activity is $1,550. If you can't make more than that because of a disability, and that disability will last 12 months or longer, then you can file for disability. I collect as on my own. When my ex dies, will Social Security go to me without the deduction for his civil service amount? Um, so you're receiving on your own, and your spouse is receiving benefits, but it's reduced based on the windfall elimination provision. And if something happens to him, no, you'll receive his benefit amount. If you're full retirement age, then you'll receive basically what his are receiving. It won't be double reduced because it's already been reduced based on his work under non-covered employment. So nope, it won't. Yeah, you're probably thinking of the government pension offset. That's if you also worked for an organization, a government entity that did not pay into Social Security. But no, so that reduction won't affect you um, more. It's already been calculated on his benefit amount. Did I hear you correctly that a wife can get benefits if her spouse is receiving SSDI? By the way, hello. If your spouse is 62 years old and you're 62, yes. So, but if your spouse is 50 and receiving SSDI, um, well, this is the divorced spouse. Okay. Oh, by the way, hello. Hey, by the way, hello. So there are exceptions on this one. So if your spouse is receiving SSDI and your current spouse, You can get benefits, but only if you have a child under the age of 16 or that became disabled before the age of 22. It's called auxiliary child and care benefits. If that's not the case, then no. I applied for my husband. He passed. I've waited now 3 months. How long? He worked at the railroad to, oh, just waiting for an answer. Oh, okay. So that's probably a railroad jurisdiction, the railroad board. So yeah, anybody that comes into Social Security and they mention that they worked at the railroad, then I've done this many, many times. We'd have to call the railroad. Ours was in Mesa, Arizona. We'd call up Mesa Railroad Board and we'd ask, "Who's got jurisdiction? Do you have jurisdiction, or we have jurisdiction?" So 3 months. That probably means the railroad has jurisdiction because Social Security, yeah, for something easy like that, it shouldn't take 3 months. But I would call whoever you filed with at Social Security, wherever, it's probably Social Security, and say, hey, are y'all working on it or did y'all punt it to the railroad board? And if they send it to the railroad board, then you need to contact them. Not familiar with MQGE. Have been advised by Social Security that it applies to my Part A free enrollment. Does this impact my survivor spouse benefits? No. Um, this is acronyms. Oh gosh, if I remember, Medicare qualified government employee. So you are MQGE. So basically, you worked for a governmental entity, state, local, federal, and you did not pay the Social Security part of FICA. So FICA has two parts, the Social Security part and the Medicare part. You did not pay the Social Security part, so you're not entitled to Social Security. But you did pay the Medicare part. Everybody pays the Medicare part. So you're qualified for the Medicare. That's it. So that's why you're getting Part A free, and you're also eligible for Part B, which does have a monthly premium. So, yep, that's it. Medicare qualified government employee. Yep. A lot of people miss that one. If you're in, Chris, if you're in any type of group of government employees, if you worked, the city or the state or something like that, if you're, a lot of people miss that. People that are MQGE qualified, and something happens, and they're looking for instance, the thing I see a lot of people miss, if they're filing for disability, and they're want to get disability, and they're like, well, they call Social Security and they want to see if they can get disability. And then disability says, no, you're not insured for disability because with Social Security, because you never really paid into Social Security disability. But what the Social Security employees are missing is what they say, you you're not qualified for disability, but you are qualified for Medicare. So if we approve you for disability, we're not going to give you any money, but in 2 years you'll be eligible for Medicare because you did pay into Medicare. That is missed way, 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 way too much. And a lot of people get good health coverage, earlier than 65 if they knew that. So if you know any groups, please share that information or tell them to come on over and join us. I take care of my clients. They love me. Awesome. Good deal. Good deal. There's some awesome Medicare insurance agents and brokers out there, and Data is Amazing sounds like one of them. Good deal. Yeah, but we need to get and I'm sure there's quite a few that ain't not proper English. How do I find a broker? I have an agent for my yada yada and plan, but I would rather have a broker. Yeah, just my group, my organization that I partner with is licensed and contracted in every single state in the country. So you can reach out to them and they can walk through, see what's available in your area. My fraud is this November. Finally got an appointment for November 13th. Will Social Security checks begin December? Yeah, if you're entitled to November benefits, then you will get your first check. Your November check will come in December. My ex has a lower Social Security benefit due to being a retired police. When he dies, can I get his full Social Security benefit without that deduction? No, because whatever his PIA is, his primary insurance amount, is his primary insurance amount. So that's what your benefit will be based on, whatever his benefit is. I'm in New York, and our Med Advantage letter states that everything stays the same, but they're adding JASA. Not sure what is included, but it's alleged they help with transport, video, or home visits. Um, JASA. I'm not. Oh, that's one acronym that. Um, I'm not sure what that acronym is. Probably some New York type of thing. But yeah, some plans, some Medicare Advantage plans throughout the country do provide transport, particularly Medicare Advantage dual eligible plans. A lot of them have some type of transportation. They can take you back and forth to the hospital and doctor's office and stuff like that. But yeah, a lot of plans have that. But a lot of plans are dropping that because, again, these companies are trying to make up for lost money because of the prescription drugs going from 8,000 to 2,000 and a bunch of other things coming down. I'm looking at an N from a three-state ACA co-op. I like the nonprofit model. In the off chance they go bankrupt, what are my options to switch to another gap plan? Underwriting. Yeah, if the company completely goes bankrupt or something like that, closes up, then you'll get a guaranteed issue to go to another plan. Did you say we have between October 15th and December 7th to get a Part D plan? I turned 65 in December. No, that's for people that are already on. They have the ability to switch their plan from October 15th to December 7th. You are in your initial enrollment period, so you can start right now, and you have 3 months. For to sign up for Part B, you have 7 months, 3 months before and 3 months after, and then your December month. So you're good. Um, in your case, so whenever you choose um, your Part B to start, so if your Part B is going to start in December, then you need to find something you know before that. So your Part B starts December 1st, and then your Medicare Part D or your Medicare Supplement, Medicare Advantage, whatever, it should all start on the same date. So I would reach out to someone about a month before. Hypothetical question. If a person is on SSDI and they lose it, how do they figure out how much retirement you would get? Yeah, that has no effect on your retirement calculation at all. No effect. So how much you will get is depend on basically how much you've been receiving so far. And if you lose it and you file early, then it's a 30% reduction. So if you wait till your full retirement age, you get basically what you were receiving on disability. All right, let's see. Patricia, not retired, 66 years old, only gets Medicare Part A and B. Talk to Social Security about when it's best to retire. We'll start applying December to start process when I'm 67 in July. Can I earn income while I get Social Security? Okay, so we'll start applying December to start the process when I'm 67 in July. Yeah, December is too early. About 3 months before if you want your benefits to start in July of next year, about 2 or 3 months before, then reach out to them. And 67, I'm sure, is your full retirement age, so you can make, let's say, $1 billion, and it won't reduce your Social Security benefit at all. Probably it will increase it unless you made $1 billion for the last 35 years. Nope. So yeah, I won't. Once you hit your full retirement age, how much you earn doesn't affect Social Security, or it doesn't negatively affect Social Security. It can only positively affect Social Security. What was the phone number to your Medicare people you put up last night that no plans where you can call insurance directly? Oh, okay, great. So I've got the number. You can call the 888 and just press 1, and then it switches you over. But here is the direct number. Let me go ahead. They're called Chapter Advisory, and they look at all the plans, and they've got a great customer care team. And yeah, they 8410632. That's the direct number. All right, let's see here. All right, we're about out of time. Let me get with someone I haven't seen here before I get some new people. Ray, I was determined eligible for supplemental security income and QMB benefits with social services. My account says I'll be starting on SSI Medicaid on 11/1. Will this qualify me for QMB? Yeah, it sounds like SSI. Determined eligible for QMB. Yeah, if you're determined for that's qualified Medicare beneficiary. That's one of the highest levels of Medicaid. So that means they're definitely going to pay for your Part B premium, that $174. So that's going to put $174.70 back in your pocket. And because you're going to have Medicare and Medicaid, um, I'm assuming you get Medicare as well. If you have Medicare and Medicaid, then you can get one of those Medicare Advantage dual eligible plans. And those are the ones I definitely recommend, not a Medicare supplement, because that's going to cost you money. It's not worth it. So a Medicare Advantage dual eligible plan. And those are the ones with all the extra benefits. So you need to do something quickly. If you have Medicare and Medicaid, you should really find a Medicare Advantage plan, dual eligible, sooner rather than later. So if you want, again, same as the other one, call that number, the 888, or the number I just posted down there. Call that number. And if they don't pick up immediately, because again, they're crazy busy, call them and then send me an email, because you need to find something sooner rather than later. So you basically you're going to have SSI, plus you're going to have Medicare, Medicaid, the extra help with prescription drug plans, the Medicare Advantage dual eligible plans. But if you're already paying for Medicare, for some reason, the $174, and the state said they're going to go and pay for it, you might have to pay for about a month or two until the system talks to each other, until the Medicaid system talks to the Social Security system, which talks to the Medicare system. So you might have to pay for it yourself for a month or two. It might come out of your Social Security check, but don't worry about it. They'll pay it back. But it might take a month. All right, this will be the last question. Michelle, I was not clear on my question. I don't want to file for ex-spouse benefits right now because at 62, they would be the same as my SSDI. I was hoping I don't lose my right at 67 to get, no, you're good. Yeah, you're on SSDI, so you shouldn't have to file for, yeah, because no, you can wait till your full retirement age, and just continue to collect your SSDI. They shouldn't, deemed filing. There's a lot of variables in there. They shouldn't make it a deemed filing on that one. But yeah. All right. We are over an hour, and it looks as though I've got a lot of questions there. Unfortunately, not able to get to today, but I will be back again tomorrow. And please cut